Thank you for taking some time to learn more about Coastal Hospice. Our mission: Coastal Hospice promotes dignity and quality of life for patients and families who face life-limiting conditions. We have a variety of programs at Coastal Hospice designed to meet many needs. Our palliative care program is specialized medical care for people with serious illness. Palliative care provides comprehensive treatment that can relieve discomfort, symptoms, and stress. It's not the same as hospice care. Instead, it's available to you at any time during a serious illness, including while receiving curative treatments. Our Coastal Kids Supportive Care provides the benefits of both medical treatment and the comfort of supportive care at the same time. This program supplements medical treatments by allowing our physicians, registered nurses, social workers, and chaplains to develop a specialized plan of care for the child. Our Compass program is a free, non-medical support program for those with serious illness who may need support and assistance obtaining resources within the community. Hospice care can be provided in a variety of locations. Residential, wherever a patient's home may be, in the community, nursing home, or assisted living facility. Coastal Hospice at the Lake is an inpatient facility designed for short-term stays, appropriate when patients need temporary, intense medical care to treat symptoms that cannot be managed at home, such as pain, breathing difficulty, or anxiety. And the Stansel House provides a safe, comfortable, and compassionate place for hospice patients who cannot safely manage their care at home. We provide grief support not only to the loved ones of our patients, but also free grief support to anyone in the community, regardless of whether or not they have had any affiliation with Coastal Hospice. Our thrift shop is located in Berlin. Our thrift shop has a huge variety of options at low prices, and all sales support the Stansel House. Coastal Hospice admission criteria. Admission criteria includes having a terminal diagnosis, having a prognosis of 6 months or less to live, and the desire for treatment focused on comfort rather than aggressive curative measures. The Coastal Hospice difference. We help people to stay in their homes. 80% of Americans say that they prefer to spend their last days at home. As you can see from the chart below, ICU admissions in the last month of life. Only 2% with hospice spent time in the ICU in their last month of life, whereas without hospice was 13%. And death in an acute care hospital, only 2% of those with hospice passed away in a hospital, whereas 54% without hospice passed away in a hospital. Our team works together to support the patients and their loved ones. Our team is made up of therapists, certified medical technicians, a hospice doctor, a nurse, a social worker, a bereavement counselor, spiritual care, and volunteers. How is hospice paid for? By Medicare, Medicaid, insurance, and community funds designed as a 6-month benefit. Supporting the community. Our organization serves Dorchester, Somerset, Wicomico, and Worcester counties. Hope and Healing with Horses is a free event for children dealing with the death of a family member or closely connected loved one in the past 2 years. We Honor Vets is a hospice program to serve and honor those who served us. When a vet comes into our care, they will receive a special visit that includes a personalized certificate, a patriotic blanket, and whenever possible, a salute from a uniformed military guard. We assist vets in enrolling in and receiving their VA benefits and can coordinate care with the VA and other healthcare organizations. On Veterans Day, we hold special honor ceremonies open to all veterans across our service area. Our grief support groups are bereavement support held in each county that we serve. Events are free and open to anyone in the community, whether or not Coastal Hospice cared for their loved one. Camp Safe Harbor is a 3-day program designed to help grieving children ages 6 through 12 with remembrance and resilience after the death of a loved one. partnership between the Social Work Department of Salisbury University and the Bereavement Program at Coastal Hospice has designed fun activities such as arts and crafts, games, support circles, music, and sports activities designed to help each child heal in their own unique way. Ways to give. Many people who have had a loved one in hospice care wish to give back in a way that is meaningful to them, whether it's their time, talent, or treasure. There are many ways that you can volunteer your time with Coastal Hospice: patient care and support, administrative assistance, our We Honor Veterans program, the Coastal Hospice Thrift Shop, and more. Again, our mission at Coastal Hospice is to promote dignity and quality of life for patients and families who face life-limiting conditions. Thank you for joining me to learn more about Coastal Hospice. Call us and we'll come to you. 800-780-7886.